If you've seen a lot of folks wearing red clothing today, there's a reason. The first Friday of February has been designated Wear Red Day by the American Heart Association. It calls attention to heart disease and simple steps women can take to lessen their risk of heart attack and stroke. And here with more is Dr. Mary Boylan, a cardiothoracic surgeon at St. Luke's Hospital in Duluth. And doctor, thank you very much for coming in. Appreciate it.
Thank you. Pleasure to be here.
Thanks for wearing red.
Right. Likewise.
What are the primary causes of heart disease in women?
So the primary causes of heart disease, and mostly when we talk about heart disease, we talk about coronary artery disease. The primary causes are the same in women and in men. They manifest a little bit differently. So the things that we think about as risk factors are things we can't control. So we can't control family history, so genetics, if our parents and everyone else we know in our family has heart disease. So genetics is one thing. High blood pressure, cholesterol, diabetes, and then some other risk factors such as physical activity, weight, smoking is a big one. So those are the commonly considered risk factors.
Doctor, what are some of the symptoms of a heart attack?
That is a great question because, if you watch a lot of these TV shows, you think a heart attack is where you're clutching your chest and trying to loosen your tie. Well, that might work if you're a man, but for women the symptoms it does, you're right. And a lot of times women don't have such dramatic symptoms. A lot of times they'll have fatigue or achiness or shortness of breath, and what happens in people who are a little bit older and they think, I must be out of shape, I must have done too much work, things like that. So it can be subtle for women, their symptoms, yeah.
If heart disease is in a woman's family history, at what age should she really start paying attention to heart health, and what types of tests should she have on a regular basis?
That is a great question because everyone thinks, well, I'm not old enough yet, I'm going to wait. And actually, we should all, from young on, every college student should know, whether it's a woman or a man, they should know their blood pressure. They should know if they have diabetes. They should know what their cholesterol numbers are. So it's really never too early. Even in kids, we should look at kids. I mean, today, a third of all children are overweight. So it's never too early to start. And a lot of times, women don't end up manifesting or having a heart attack until probably about, 60s, later 60s. And for men, it's usually about in the 50s when they start showing up with heart attacks.
Is bypass surgery being replaced by newer surgical procedures?
So I'm a heart surgeon, as you know, and I'm glad to say that heart surgery and bypass surgery remains a mainstay of treatment for coronary artery disease. So there are new medicines and new drugs and things that can hold coronary artery disease at bay for a while. And when we have to do interventions, we have many options in terms of coronary stenting that our cardiologists do. But the basic rerouting and revascularization is what we call it. The basic bypass surgery is a mainstay of treatment for coronary artery disease.
So why do some patients have stents and others have bypass?
So we fortunately have lots of data on it. So we have good guidelines to look at. For a patient who has a weaker heart, diabetes, multiple vessels that are involved, those are patients who are often better treated with bypass surgery. If it's just one vessel and it's something the cardiologist can go in and we can put a stent in there and pop that vessel open and avoid a surgery, then that's a very good option too. So we look at the person's age, their risk factors, how will they tolerate an operation, what is a better option for them? Are they able to tolerate the medications that they need to be on after stenting?
Can you talk about some of the specific lifestyle choices that people can make that would reduce their risk of heart disease?
So the good news about this is almost 80% of heart problems can be modified or avoided. So the American Heart Association has their website, and they have Life's Simple 7. So it talks about what we can do in our every day to make a change. So number one, don't smoke. So very few absolutes in medicine. Never smoke is an absolute in medicine we can all take to the bank and rely on. Managing weight, being physically active. So managing weight, being physically active, activity, knowing what our cholesterol is, keeping it under control, diet, if we have diabetes, managing it. So those are things, and the great news is improving any one of those reduces risk.
Can the same factors cause a stroke?
That is, you know, that is exactly, it's a whole big picture because we think of it as cardiovascular disease. So a lot of times we focus on the heart, but a stroke is the same disease process, the same disease in the vessels, except it's the vessels that go to our brain.
Mm-hmm.
So if you have a clot in a vessel on the heart, you have a heart attack. If you have a blockage in a vessel to the brain, we have a brain attack or a stroke.
And we just have a few seconds left, but I know you wanted to mention the March 1st luncheon.
Yes, yeah. So every year, American Heart Association has a Go Red for Women luncheon to really get the word out. And this year, it's this March 1st at the deck. And there's a website to contact. You know, it's a great way. A lot of women come. They bring their spouses. They sometimes bring their kids and learn a lot about how to get a better, healthier life.
Wonderful.
All right. Thank you very much, Dr.
Thank you, Doctor.
Thank you.
Appreciate
A pleasure. Absolutely.
I was